Hi there, my name is Jennifer. I wanted to talk today about peripheral nerve blocks. If you have CRPS, or if you have some sort of injury to your arm, or if you're about to have surgery, sometimes what they'll do, especially if you're gonna have surgery, is once you're already kind of sedated, they'll do a nerve block directly into your arm, and they'll tell you that they're gonna be doing this in advance, but they will basically numb up just your arm so that you don't feel as much pain during your recovery. But for chronic pain sufferers like myself, I have a condition called CRPS, complex regional pain syndrome. It's basically where I'm in pain 24 hours a day. There's no time when I'm not in pain. It just depends, like the degree of pain is dependent on my medication. And I also have had a lot of what's called a stellate ganglion nerve block. And that is, so my injury is to my arm. I had a dog bite that was right there. So the stellate ganglion nerve block, they put a needle with they use ultrasound, and then it's ultrasound guided nerve block. So it's basically they put the ultrasound machine and they put the needle into, it's usually about this area right here, and that kind of blocks like the whole nerve branch that goes to the whole arm. But what I have found is I don't lose any function in my arm whatsoever when I get those stellate ganglion nerve blocks. This is called a peripheral nerve block. So this is a completely different, this is where they're isolating the actual nerve that is causing pain, or will be in the region of where you're having like your procedure, your surgery. And so for me, it was identified early on that my radial nerve was greatly affected by this dog bite. Now I have the complication of decreased range of motion. So I can only, so right now when my arm is like this, this is as far as my wrist can go forward, and then my wrist can go back about like that. So this is as much as I have. Now, normally I can do that by myself. I can move my wrist like that much, but because of this nerve block, I have zero function in my arm. So what happened with this, that the very big difference between a stellate ganglion nerve block and a peripheral nerve block is the process in which they do it is similar, but with the stellate ganglion nerve block, you have to go into the surgery center. It's basically you're having a procedure, where you have to have like anesthesiologist is the one that is performing these procedures, but it's much more, it's like you're going into the hospital for the day. Whereas this, a peripheral nerve block, is a procedure where you're just going into the office and you're leaving. I didn't have to change my clothes. I didn't have to do anything special. I just walked in. My husband was able to come in the room with me. But what they did with this is they basically did the same procedure with getting the ultrasound machine, going through identifying all the different nerves after discussing it with me and talking about me identifying where my main pain centers were. Now with CRPS can vary from person to person. Not everybody's going to have like a textbook case, and from one person to the next, it could be very different symptoms. For me, because I've already had 5 stellate ganglion nerve blocks, I have I'm pretty well medicated, enough to take the edge off almost all the time. And so my range of pain is usually only between 4 and 6 is like my baseline pain when I'm medicated. And medicated, I just mean I take Lyrica, over the counter, like acetaminophen. That's all I take. I occasionally have to take baclofen, occasionally have to take hydrocodone, but that's more rare. But I do have to still do that when I have like a flare. But my baseline pain is between a 4 and a 6 on a typical day, but it can reach up higher than 6, like maybe between 6 and 8 if I'm in a flare. And I also have CRPS spread. And so it's no longer just in my one arm, it's in my left hand and arm and my feet and my face. And so I often will have pain in other areas greater than the pain I actually have in my original site, because I have had so many nerve blocks for my right arm. I have not had anything for the rest of my body. I only have the Lyrica, like the nerve pain medication, which is Lyrica, gabapentin. That's all in the same category. But so anyway, the big difference with getting this nerve block, so he did it in 2 areas. He did it here And here you can see by the band-aids. Now it's been 4.5 hours since I had this done. It was done at Stanford in Redwood City location by an anesthesiologist. And he's not my typical doctor, but he's done 2 of my nerve blocks in my neck. And so he's really great. So, but the big difference is I have zero function now in my hand and my wrist. And what's very odd is that when I was first injured, I had a broken arm. And so I went 8+ months with zero function. And I slowly started to regain like, my ability to sort of like pinch a little bit. I mean, looking at my arm now, you would have no idea how severely bad my injury was, because like when I went to physical therapy, it's like for the first time, my hand was stuck like extended backwards like this, and my fingers were spread, and I was like in a claw, but my whole hand was so swollen. My fingers were like this, but my fingers were touching. That's how swollen I was. And my arm was in this degree of flexion. Like I couldn't straighten my arm. And so I was basically like, it's hard to see right here, but I was like that. And so the fact that I'm almost straight, I'm not fully straight. I've made some remarkable progress, but with the peripheral nerve block, it has completely numbed my whole top part. Like this is not numb. This is not numb, but because he did the radial nerve, this whole top part of my arm is numb. And it's kind of like when you go and you get Novocaine at the dentist, and you know how like your mouth and your lip is numb? That's what my whole arm feels like. My whole arm kind of feels like, almost like a log. It feels weird. But I wanted to talk about, I was very worried about pain, because I do suffer from a severe pain condition, a chronic pain condition. I was nervous about pain. And what I wanted to talk about with that part is, to be honest, the part that hurt the most, and it did not even hurt a ton, it just hurt more than if I was just sitting there, like sitting still. It hurt more when he was doing this particular thing than if I was, you know what I mean, is that when he was using the ultrasound machine, they do have to sort of press a little bit. And so that was not great, but it was tolerable. And I did go in with my acetaminophen and my Lyrica on board. So I was medicated, but it wasn't terrible. It was, like I said, I was aware. I was much more aware of my pain increased when he was doing the ultrasound. But what I was really worried about going into it was the needles. I was very worried because this is a very sensitive part of our bodies. This is a part of our body that causes us so much pain. The idea of getting a needle, I mean, I would never get an IV or a blood sugar test. I would never do anything on my right arm that would involve puncturing the skin for any reason on my CRPS arm. Like, no way. I barely felt these needles. They are a little bit long, but they're not very fat. So, I mean, he was so gentle going in. I can't say enough about this doctor. There was very little pain with the actual insertion of the needle. Now, when he started to administer the medication, it did cause like a zing to go down into my fingers, like an electrical pulse, like, and that was a little bit of a shock, but it wasn't terribly painful. And then when he finished that up, but he was having to push so hard on here. I actually finally had to tell him that it was getting a little bit too intense for me. So I had to say something, and he actually stopped like immediately. And because he was already doing the nerve blocks, he asked if because I had the 2 areas, if we wanted to go ahead and do a second nerve block right here, which I was like, absolutely, please. And so he did do the 2. Typically, I believe that they would typically only do 1 area. But what I guess what I wanted to say is that getting the actual procedure was not as scary as I expected it to be. It wasn't as painful as I expected it to be. Now, it's been 4.5 hours. And I'm actually just right now, I'm starting to have burning sensation in the palm of my hand, which I'm only I have gone 4.5 hours with very little pain. And so that's remarkable right there. But so it doesn't last a ton. So, but I often have pain in different areas. And so the fact I'm only having the pain so far in the palm of my hand, I mean, that sucks. But yeah, I just really want to kind of encourage you to not be, not like don't be scared. I mean, I was pretty nervous. Like my heart rate was like way up and my blood pressure was up because I was like so nervous, but it was a lot less. Now, what I did not realize is because there was so little information about this online that I didn't realize just how numb my arm would be. And the fact that I have like no function of my hand. I had just, like I was saying, I had just gained some function in my thumb. And so, and my fingers, I could move like maybe like this much. And so like right now, I think I could move like that. I don't know if you can really kind of like see, I can kind of go like that. And that's kind of all I could do. I can't do much more than that on a normal basis, but I can usually, like, I can't move this finger, like my pointer finger, like at all. But these three are moving a little bit now. And I'm willing my hand to move. It's the weirdest thing. It's really bizarre. But yeah, so that's all. I just wanted to show you about the peripheral nerve block and the fact that you have complete like dead, like they call it drop wrist, where like if I didn't have this issue with my wrist, my hand would be hanging, you know, like this without any control. But so this is where I'm at right now. So this is as far as my wrist can go. But considering, like I said, I started from this and now I'm at this. I mean, that's but I must say I did lose the ability to go this far back with this hand. So now I can only go like I guess like there. So I have like, I don't know, maybe like 15 degrees of range of motion. But anyway, if you have any questions, leave them below and I will try to answer them. But yeah, it's not too bad. It just kind of, it's a bummer I can't use my hand at all, because you do kind of realize how even with reduced function, I've still been able to sort of adapt and use what little function I do have. I've been able to figure out how to use that like in my daily life just to make my life a little bit easier. And so the fact that right now I don't have any function at all, it's kind of a bummer. But to go for a couple of hours with no pain, I would say this time definitely worth it. Okay, bye guys.